Hello everyone and welcome. I'm Dr. Asim Haseen. Today I'm excited to discuss the 2024 KDIGO Guidelines update, focusing on the highlights and clinical implications. We'll be exploring what's new, how it impacts our practice, and what it means for patient care. Let's get started. Let's take a moment to look at the background of the KDIGO 2024 Clinical Practice Guideline. This new guideline was published in March 2024, and it marks a significant update, replacing the previous 2012 version. The key here is that it's evidence-based, meaning it's built on the latest research and clinical data. The guideline offers comprehensive recommendations for how we should detect, classify, and stratify the risk of chronic kidney disease. It's designed to be applicable across various clinical settings, from specialized nephrology clinics to intensive care units. Overall, this update is about ensuring we have the most current and reliable tools to manage CKD effectively, aligning with our goal to improve patient outcomes through the best available evidence. Let's take a closer look at the updated CKD evaluation and classification. The new guidelines introduce some important changes, especially in how we define, stage, and assess the risk of CKD. There's now a greater emphasis on detecting structural abnormalities and persistent markers of kidney damage, which helps us identify issues earlier and more accurately. Additionally, the use of validated risk prediction equations is encouraged to better assess the likelihood of decline and complications over time. Moving on to GFR estimation, the latest guidelines recommend incorporating serum cystatin C alongside creatinine in the eGFR equations. This combination provides a more accurate assessment of kidney function, especially in diverse patient populations, where creatinine alone might be less reliable. Overall, these updates aim to improve our ability to diagnose and manage CKD more precisely, aligning with the broader goal of personalized and proactive kidney care. Now, let's take a closer look at personalized therapeutic strategies outlined in the 2024 KDIGO Guidelines. The focus here is on tailoring treatments to each patient's unique situation to slow the progression of chronic kidney disease and lower cardiovascular risk. First, SGLT2 inhibitors have expanded their role. They're now strongly recommended not only for diabetic CKD, but also for adults with CKD regardless of diabetes status, especially if there's proteinuria or a high risk of disease progression. This marks a significant shift toward broader use, emphasizing their protective benefits. Next, we have RAAS inhibitors. These remain a cornerstone of therapy. Continuing them helps manage proteinuria and control blood pressure, which are crucial in slowing CKD progression. Then there's the role of statins. They are recommended to reduce the risk of atherosclerotic cardiovascular disease in CKD patients. Given the high cardiovascular risk in this population, statins are an important part of comprehensive care. Finally, for patients with type 2 diabetes and CKD, GLP-1 receptor agonists are now recommended when glycemic control is insufficient and cardiovascular risk reduction is desired. These agents can provide dual benefits, improving blood sugar levels while also offering cardiovascular protection. Overall, these strategies highlight the move toward individualized care, integrating various therapies based on each patient's specific risks and needs. Now, let's turn our attention to the next important update in the 2024 KDIGO Guidelines. This slide focuses on patient-centered care. What's really encouraging here is the increased emphasis on shared decision-making. This means actively involving patients in their care plans, ensuring their values and preferences are part of the conversation. It also highlights the importance of lifestyle approaches like diet, exercise, and smoking cessation, which are crucial in managing CKD effectively. And of course, multidisciplinary care plays a key role, collaborating across different healthcare providers to offer comprehensive support. Ultimately, these updates reinforce that caring for CKD isn't just about managing lab values, but about supporting patients holistically. empowering them to take an active role in their health journey. Let's talk about diagnosis and risk stratification. To accurately stage kidney disease, we should primarily use eGFR, which is calculated from creatinine levels, and when appropriate, include cystatin C for an even more precise assessment. This helps us get a clearer picture of kidney function. Next, assessing albuminuria through the albumin to creatinine ratio, or ACR, is crucial because it serves as an independent marker of risk. Elevated albumin levels in the urine indicate kidney damage and help us identify patients at higher risk of progression and cardiovascular events. Finally, applying validated risk prediction models is essential for guiding how we monitor these patients and determine the appropriate intensity of treatment. These models improve our ability to personalize care and make informed decisions. All these steps, aligned with the 2024 KDIGO Guidelines update, reinforce the importance of thorough, evidence-based risk assessment to improve patient outcomes. Let's talk about the treatment and therapeutic priorities for CKD. When it comes to medical therapy, there are several key approaches we should consider. First, SGLT2 inhibitors have shown significant benefits, especially in patients with proteinuric CKD, whether they have diabetes or not. These drugs help reduce protein loss and can slow disease progression. Next, RAAS blockade remains a cornerstone for managing blood pressure and controlling proteinuria, which are crucial factors in slowing CKD progression. Alongside that, statins are important for reducing cardiovascular risk, which is a major concern in CKD patients. We also need to think about GLP-1 receptor agonists, especially when indicated for glycemic control, as they offer additional cardiovascular benefits. Most importantly, therapy should always be tailored to each patient, considering their individual risk factors and what they prefer. The 2024 KDIGO Guidelines emphasize this personalized approach, ensuring we optimize treatment for each person. Overall, the goal is to combine these therapies thoughtfully to improve outcomes and slow the progression of CKD. Let's take a look at the implementation tools we've developed. We've introduced new infographics, slides, webinars, and clinical tools designed to make it easier to incorporate these updated recommendations into everyday practice. These resources are meant to support clinicians like you in staying aligned with the latest guidelines. As we move forward, these tools will help streamline the integration process, ensuring that patient care benefits from the most current evidence and best practices. Remember, the goal is to make these updates not just theoretical, but practical and accessible in your daily clinical routines. Let's take a closer look at what this means for ICU and MRCP contexts. First, CKD recognition is crucial. Early detection, even incidental findings in hospitalized or ICU patients, should prompt us to evaluate the risk of progression and address modifiable factors like blood pressure and proteinuria. This proactive approach can really change patient outcomes. Next, cardiovascular risk is now at the core of CKD management. It's no longer just about protecting the kidneys. Reducing cardiovascular risk has become a key target, highlighting how interconnected these conditions are. We're also moving toward precision medicine. Genetic testing and personalized strategies are no longer optional extras. They are now integrated into the guidelines for selected patients, helping us tailor treatments more effectively. Finally, looking ahead, dedicated research priorities are clearly defined. These focus on filling evidence gaps, especially regarding early CKD progression, and how we implement these new strategies in real-world settings. All of these points underscore the evolving landscape of CKD management, emphasizing early detection, cardiovascular health, personalized care, and ongoing research to improve outcomes for our patients. Let's now review some high-yield pearls from the 2024 KDIGO Guidelines for CKD management. First, SGLT2 inhibitors are recommended for patients with CKD who have proteinuria, regardless of whether they have diabetes or not. This marks a significant shift towards targeted therapy in CKD care. Next, RAAS blockade remains a cornerstone of treatment. It's still fundamental in slowing disease progression and protecting kidney function. When evaluating CKD, it's crucial to include accurate measurements of eGFR, ideally using both creatinine and cystatin C when appropriate, along with assessing albuminuria. This comprehensive approach helps us better understand disease severity. Additionally, risk prediction equations are now integrated into practice. These tools help us personalize prognosis and determine the appropriate level of management for each patient. Finally, adopting patient-centered and multidisciplinary strategies has been shown to improve long-term outcomes. Emphasizing a holistic approach ensures we address all aspects of the patient's health and optimize their care journey. These updates highlight the importance of tailored, evidence-based management to improve patient outcomes in CKD. Thank you so much for your time and attention today. I really appreciate the opportunity to share these insights with you. Remember, the key points we've discussed highlight the importance of understanding the core concepts and applying them effectively. I hope this presentation has provided you with useful ideas and inspiration to take away. If you have any questions or want to explore these topics further, please feel free to reach out. Thanks again for being such an engaged audience.